Hi, Dennis. Dennis, can you hear me? I can't hear you. Turn your, unmute yourself.
Hey, Joel, this is Bruce. How are you doing?
Hey, Bruce, how are you?
Good.
Long time.
Yes.
I can hear you, Joel.
Oh, good. I can hear you now.
All right, well, I have 6 o'clock, so let's get started. First of all, I want to welcome everybody to this Zoom meeting. I'm really overwhelmed by how many people showed up. My name is Ashley Battistini. I'm the current chair of the Criminal Justice section of Division 18, so it wouldn't be a division event if I didn't briefly mention or encourage you to add the CJ section to your APA membership. If you're not a member of Division 18 or the CJ section, I would really encourage you to join and be part of our regular membership group and get other access to other things that we're doing. So I want to first of all thank Dr. Joel Dvoskin for volunteering his time. Some of you know Joel personally, some of you have heard of him. For those of you who haven't, he's a nationally and internationally recognized board certified psychologist who has a lot of experience in total confinement settings, including jails, prisons, state hospitals, and he's been involved in a number of crisis situations. Of course, not exactly like what we're facing right now. I don't think anybody has a lot of experience with what's going on presently, but if anybody has the experience to share, it would be Joel. So thank you, Joel, for taking the time to meet with us and talk with us. The purpose of this meeting is to be more informal and to just provide an open forum for you all as providers and practitioners to listen and get some advice, but also share your experiences and hopefully learn from each other and learn from of course Joel, who's our guest speaker tonight, but really we're hoping to keep this somewhat informal, and so please feel free to participate or jump in as you feel so compelled to do. You can do that through the chat box. I believe there's also, although I couldn't figure it out before we started, there's also a feature where you can raise your hand and we can have people participate that way. I just would remind you, if you're muted and you want to contribute something, make sure that you unmute yourself. And again, we would love to see your faces. So if you are so inclined to activate your camera, we'd love to see you and interact with you. So again, this is just meant to be an open forum and rather informal. I know everybody's kind of been inundated with workshops and webinars and things like that on dealing with the pandemic, and this is really geared towards you all and trying to provide you some resources and just some space to talk about some of the difficulties that you've been experiencing. I'm going to just start us off with a question, and then we can just kind of go from there, and we'll open it up for others to add their questions. So one question just to start us off for you, Joel, with in-custody settings becoming even more chaotic and confined than usual, how can public service professionals stay organized and make necessary space for themselves when it feels like there isn't a lot of space to be had in these settings?
Well, it certainly depends on what your role is, number one. So if you're providing clinical services, that's one role. Much of that can be done by telemedicine. I'll talk a little bit about the choice between in-person and telemedicine. if your role is as an evaluator, you have some decisions to make about what the purpose of the evaluation is and what you need to do to accomplish it. So in other settings, we've been having some discussions, and people seem to me to be kind of falling into two camps. One is that it's impossible for me to do an adequate evaluation over video, and other people are saying I do it all the time and it's working fine. It depends on a lot. I mean, I'm a psychologist, so if you ask me any question, I'm always going to say it depends. It depends on the type of evaluation and like what testing you feel you need to do. Some testing you can do over video, some testing you can't. Some people, I think, are using video at least as the first shot out of the box and then making a decision about whether or not they can complete the evaluation without just by doing it on video. The next question is, how safe do you feel going to the jail? And I want to spend a minute talking about that. So I just read a paper by a friend of mine who runs a forensic psychiatric hospital. And they had, in late March, no cases on a unit, and then they had patient 0, 1 case. A week and a half later, 80% of the patients were infected. So, and especially those of you who work in jails, where oftentimes there's sort of a barracks situation where people are sleeping within a few feet of each other, it's pretty likely that the infection is going to be widespread. I would say to you, and I'm certainly not an epidemiologist or a virologist, but I would say to you that I'm keeping pretty close tabs on this. And it's very clear to me that we don't know very much. I most appreciate the people who are honest about that. So for example, if someone has had the virus, it seems pretty likely that they have some immunity, but we don't know that for sure. We don't know how strong that immunity is, and we don't know how long it lasts. I suspect we'll know more about that relatively soon. So if you think about what we knew in March compared to what we know less than 2 months later, we're learning stuff all the time about this, and really smart people are looking into it. So you still have to make a decision of based on what I know. Do I feel safe or not safe? If you're not safe, you're not going to be much help to anybody, either as a treating clinician or as an evaluator. If you're terrified to be there, I mean, my advice is don't go. I don't think you should risk your life, and I don't think that you would do a very good job anyway. For those of you who have a setup that's safe enough, then try to make arrangements where you can participate in a way that you feel is safe. So that means, are there barriers? Is there distancing? Do you have a face mask or a N95 mask? And in my experience, the institutions value you probably more than you realize that they do. So if you want to work with them to try to make yourself feel safe, they'll probably try to be as flexible as it's possible for them to be. But at the end of the day, you're still going to have to decide, can I do this safely or not? And I respect the hell out of anybody who makes either decision. If I could just say one last thing about that is, when you see these debates on listservs and on Facebook and wherever you look for opinions, it's really clear to me that people are scared of different things right now. Some people are scared of not working. Some people are scared of getting sick. Some people are scared of both. And it bothers me when I see people being unkind to each other because you don't fear the same thing that I fear. And if there has ever been a time for us to cut each other a break, this is it. I believe that with all my heart, that we're all doing the best we can with this. And if your fears are different than mine, it doesn't mean you're wrong and it doesn't mean I'm wrong. It just means that our values are different, and I have a lot of risk factors, so I'm hunkered down. I'm pretty scared of getting this thing. I have other friends that are a lot less scared than I am, but they're scared of not being able to feed their family or to buy medicine for their kids. Well, I respect the hell out of that. I should be kind to them. So this is supposed to be an open forum. So if you have any questions or opinions, just unmute yourself and speak up, please. You might have to ask one more, Ashley, just to get them going.
It's okay. I have 6 of them. So if we are feeling in need for other questions, I have a few. So kind of related to that, how would you recommend staff on the front lines in total confinement facilities best advocate for their needs to upper administration? So if people are feeling really unsafe, or they want to make accommodations to how they're doing their day-to-day tasks, how can they voice those concerns to higher ups?
Well, early in my career, I was a correctional administrator, and then later I became I was a CEO of one hospital and then multiple hospitals. And the thing I was the worst at was fixing problems that nobody told me about. So, it's kind of intimidating if especially if you're a young psychologist, you haven't been working there very long, and you don't want to walk into the warden's office, except that you can. And I would say you must. If you have fears that are going to make it impossible for you to work or to work well, they might be able to help you, but not if you don't tell them what you need or what you're worried about. So the thing about speaking truth to power is it's always terrifying until you do it. And then it's like, well, that was easy. You just got to tell them. I was talking to some psychologists before this virus hit, and they were saying, well, the jail director won't accommodate me to do my testing. They won't let me bring a recorder in. And so I can't do it. I need to record the evaluation. I said, well, have you talked to them? They said, well, no, they just told me that was the rule. I said, well, go talk to them. First of all, most people nowadays, when they say I'm going to record, they bring their cell phone. Well, you can't bring a cell phone into a jail. It's a really dangerous piece of contraband. But they might let you bring one of these $40 Olympus recorders in because it's not a cell phone. But you got to talk to them before you figure out what exactly is it that they're trying to prevent or to make happen, and how can you work within their framework without endangering their jail. That's the main thing they care about is, are you going to endanger my people? It's my number one job is to keep everybody safe here. Staff, inmates, patients, visitors, volunteers. And if I think you're going to jeopardize that, then I'm not going to accommodate you. But the only way to do that is to talk together.
So maybe thinking through some alternatives in advance and propose some ideas to accommodate things that are of concern.
Definitely. And I would say, my grandmother used to say, God gave you 2 ears and 1 mouth for a reason. Listen to them. Listen to them really well. I've been working with people that run institutions pretty much my whole adult life. Very few of them are really stupid. So if you just listen to them and hear them out of what their concerns are, sometimes you might come to the conclusion that they actually know what they're talking about. So, Bruce, were you going to say something?
Yeah. Yeah. So what types of questions you should ask, or what sorts of things you should look at in terms of evaluating the relative risk of going into a particular correctional facility?
Well, it's probably different than it's going to be in a few weeks. Right now, I question whether they know how much infection they have. So over a few weeks from now, I think they're going to have a much better idea of, I think there's some places that think they have no infections or hardly any infections at all and are jumping all over it by isolating or even releasing people that they think are infected. I think there's other places that don't have a clue whether and how much infection they have in their population. So that's one question I would ask is, how much infection do you have and how do you know? Have they done testing? Have they done any random testing? Are they going by death, which is the most reliable indicator? That's the one that doesn't depend on testing. Do they have any access to tests? Well, again, so far it's not very good, but it's allegedly getting better every day. So they may have a much better idea. Is there adequate personal protective equipment so that you can be at a safe distance, you can wear a mask, and I would say an N95 mask, because it actually protects you a little bit. They say it only protects in the other direction, but I don't believe that's true. I think it's not a complete protection, but it helps. A face shield would probably be even safer. So those are questions you want to ask. I would want to talk to their facilities medical director to get their opinion, so that they see a different side of it than the warden or the jail director or the facility director does. And ask them how comfortable they are. Some of them aren't coming to work either right now because they don't think it's safe to be there at all, and they're working by distance. So that's a question I would ask. Another question I would ask is how flexible they can be in terms of the situation. So is there a room you can be in? Is there a barrier? If you think that's appropriate. I remember when I used to do evaluations of people that had a history of severe violence before, nothing to do with this virus, I would ask questions about, how's he been acting? There have been a couple occasions where I asked for a correctional officer to make sure they had constant visual observation of me, even though they couldn't hear me. So if the person tried to assault me, they could be there within 4 or 5 seconds. Just kind of using my common sense of what's the safest way to do this. And there were times when I thought the answer was there isn't one. And then I had to try to figure out some other way to get the job done. Very rarely, I think a couple of times I did it in the non-contact visiting area, which was a much worse evaluation to me, but I couldn't hear him very well, but it was better than nothing. And it helped give me information about what else I needed to do. It also gave me a chance to assess them of whether I would feel safe being in a room with them. So there's a lot of questions, and it's going to vary by where you are and what your job is, I think.
Do you think that the amount of COVID-19 in the community would lessen the risk if it was really low in terms of that particular facility. For example, my last evaluation was the first week of March in this regional jail in the middle of nowhere in Wyoming. And they probably still don't have any COVID cases there. Who knows? But it was a pretty rural jail. So my thinking is that if it's a community where there really haven't been many COVID virus cases, maybe that jail wouldn't be so risky as, let's say, a big city jail like Cook County or the ones in Chicago or Miami or New York City.
Well, first let me say that question is above my pay grade.
Yeah.
It's a medical question.
Yeah.
It seems to make sense to me. I would probably ask either an epidemiologist or a physician in that community if they thought that was right.
Okay.
But
Yeah. Well,
you know,
you're like me. I don't know. It's just okay.
I often say if the correct answer to a question is I don't know, then any other answer is a lie. So I don't want to lie to you.
Okay. Great. Thanks.
Sure.
I'm gonna jump in here for a second. Can you hear me okay?
Yeah, Jennifer, how are you?
Good, thank you so much. First, just wanted to say I appreciate this conversation so much. I'm a very new psychologist in the field and working in correctional facilities. So this is obviously ongoing conversations, and I've been writing down all the questions that you have. There's been a jail that I've gone to recently where I've had some concerns and haven't been sure how to quite go about talking to people about it. So I appreciate that. A couple of other questions I just wanted to add that I have asked are just one, what their current visitation policies are, in that some facilities are still allowing families or other people in, some are just allowing professionals, some are allowing none. So I think that would also speak to the level of potential exposure. And also the second question has just been about what their cleaning policies are of the visitation area. I think recently I spoke to a local county jail and asked that question, and the person at the front desk said, I'm not sure. And that really provided me the answer that I was looking for, which is probably there's not a whole lot of cleaning policies there. So that made me feel a little bit less comfortable providing the work there. So I just wanted to share that those were some additional questions I had.
Those are extremely helpful. Most jails now are just doing video visiting if they can. And a lot of jails are doing that for a long time. It's much safer for everybody. It's much cheaper for the jail. It's not very satisfying to the detainees. And for short stay people, it's fine. For people that are in jail for, a year or even longer, it's pretty depressing. But a lot of jails were doing it long before this, and a lot of jails have gone to it recently. But those are great questions. I agree with you.
Does anyone else have a question?
I actually have a question. Hi. I don't know if you can see me yet. I'm Loandra Torres.
Loandra?
Yes, that's me.
Welcome.
I am currently the clinical director for the Court Services Department in Colorado. And we have a very centralized system in that all referrals for competency evaluations come to us. And we have been working with 2 state hospitals, 64 different jails, and a slew of bond defendants. So this has been quite the task over the last couple of months in terms of setting up options that keep us safe. I sort of want to focus on the jails that we have worked out. We have been able to set up some video conferencing methods to do evaluations at a number of our jails at this point in time. But one thing that we bump up against every so often is jails requiring that a third person be in the room for the purposes of making sure that the defendant is okay with the laptop that we have essentially given to the jail. And this has caused some contention amongst evaluators who don't want a third person in the room for the purposes of completing a competency evaluation. And I fully understand where they're coming from when they voice their concerns about not knowing how to address the impact that a third person might have on the evaluation as it relates to things of validity and reliability, and concerns that that third person could get subpoenaed to testify. So I feel like the guidance that I have given them in these situations is to really assess who that third person is, issues related to the case, whether it's a high profile case or not. Because as you said earlier, the question is always, it depends. I don't think it will flat out invalidate evaluations, but I'm just wondering if you have any recommendations for me in terms of how I can further guide this set of evaluators as it relates to this issue, in terms of how to assess that third person and how to safeguard against any of the concerns that they might have.
Well, I know your system very well. I was the monitor there for a while. A lot of great people in Colorado. And now you have Dan Murray and Neil Goen-Smith, and they're
Yes.
the best. You hit the jackpot with those two. So you ask some great questions. So let me start with the question of validity. When people talk about third-party observers or recording of evaluations, I think that's a very misleading way to phrase the question, because evaluations consist of two different parts: testing and interviews. So for testing, there's some arguments against third-party observers that I think are reasonable, mainly test security. And again, it depends on the test. Some of these tests you can get on eBay, so the test security issue may be a little bit overblown. But the other part of it is interviews, and interviews don't have validity. So I have never understood the argument that an interview is not less valid if there's a third-party observer. There's no scientific basis, to my opinion, for that statement. In fact, there's some reason to think they're more valid, because there's some research that says people are less likely to lie when what they say is being observed by another person, so they can't say, I never said that. But I would say if you're recording the interview, then the need for a third-party observer almost disappears from the point of view of the evaluators. So the next question is protecting the equipment. When I used to do, up until very recently, I worked in jails and prisons and hospitals all over the country. And a lot of the people I talked to had histories of very, very extreme violence. And one of the things I always did was I would ask the sergeant, is it safe for me to be in a room with this guy? And if the sergeant said no, I usually listened to him. I mean, I would say, tell me more about it. Why? How has he been acting? Why do you say that? But I'm not getting paid to get my self hurt. So I would ask, what's a safe way for me to evaluate him? What's a safe way for me to interview him? I think maybe you could do the same thing with the equipment. Some people who are getting a competency evaluation have very, very little likelihood of damaging anything. And some people have a pretty high likelihood. The people who would know the answer to that best are the people who are spending 8 hours a day with these folks. So that might be one thing I would at least open up in a discussion is, does it have to be the same for everybody, or could we make and by the way, some of these folks are being seen by nurses where there's medical equipment in the room. Some people are being seen by physicians. So it's not like they don't have some data on how unruly this person is likely to be. The third possibility is they do have much safer ways. For example, a tablet. They have tablets that they use in some facilities, especially psychiatric hospitals, that are almost very, very difficult to destroy. They have rubber around the edges of them, and you can do what we're doing on a tablet. I suspect some of the people who are on this call are on a tablet. So you can do that. Finally, you can have somebody watch them through the plexiglass. They don't have to be in the room. They don't have to hear anything, but they can watch the person so that if they start to misbehave or destroy something, a staff member can come in and enter the room. And, maybe they'll be too late, but there's plenty of stuff they can break. TVs get broken all the time. Probably the starting place I would think about is to see if you can buy some of those safe tablets. And they're not very expensive, by the way. Did I cover everything you asked?
Yeah, I think so. And I think just in terms of, how to guide evaluators, because we've purchased a series of Chromebooks, so it's more of a laptop than a tablet, but we've gotten a lot of the jails to figure out how to manage this and keep the equipment safe. I'm just wondering how best to guide evaluators who do have those concerns about validity. And as you said, there's really no scientific basis that an interview in and of itself has validity. I don't know if that will change their opinions on the matter, but I can certainly try it.
Well, the other thing is in places where it's not a problem, you can have those places talk to places that think it's a problem and ask them, how did you do it that it works out safely?
Okay.
Jails generally don't talk to each other that much, but you can cause them to do that. I mean, ask the jail director, call Sue Jones, who runs the jail in Arapahoe County, and ask her, how do they do it? And see if they get a different answer. As far as the validity question, I mean, honestly, I'm sort of a Charlie Brown. I always try to look at both sides of everything. I don't know another side to the question of whether or not an interview has validity. I don't know what norm would you compare it to. Literally, scientifically, I don't understand what other answer there could be to that. I think it's more of, well, that's not how I usually do it.
Mm-hmm.
And my answer to that would be, nothing we're doing is how we usually do it right now. These are bizarre, unprecedented times, and we all have to figure out how flexible we can be and what our limit is. And if the limit is the safety of my family or my safety, I might say that's the end of my flexibility. Otherwise, I'm trying to figure out, think about what psychologists ought to be good at. One of the things that every psychologist should be good at is problem solving. Think about what we were trained to do. People come to us with problems of living. We help them to embrace solutions to those problems. Well, that's what these are. These are problems. And the more creative and flexible we can be, knowing that it's not unlimited, that there's a limit to how far I'm willing to go. But short of that, I'm going to be as creative of a problem solver as I can possibly be. That was great. Thank you for that.
Thank you.
What other questions do folks have? I know there's some people on here who are in state prisons and state psychiatric hospitals.
Hi, I'm Stephanie Howard, and I am at Mississippi State Hospital. I don't know if you can see my video.
I can, Stephanie. How are you?
I'm good. How are you?
Good. Tell Dr. Recor I said hi.
I will. He might be in on this call, actually, because he's the one that told me about it. So I just wanted to comment about the last question. And because we are at an inpatient state hospital, we always have a third party, be it MHTs usually, in the evaluation with us. And so if that is kind of a concern about the validity, that's actually something that I really haven't thought about until recently with COVID, with doing visual or using video conferencing evaluations, because it's something that is so standard in our practice, that I just thought I'd share that fact. For those who maybe are used to doing it in the jail, we always have third-party observers involved, and I don't think I mean, I guess I wouldn't know if it impacted our results because we always have that, but I just thought I would share that.
But by the way, one other part of the last question was, well, they could be called as a witness. You could call every correctional officer as a witness. I think if a lawyer wanted to do that, first of all, it's not my business, it's the lawyer problem, but I think the lawyers would be pretty successful at saying, come on, judge, this is, they were just there to keep everybody safe, especially if it's recorded, because then there can't be any dispute about what exactly, did you ask a leading question? Did you mischaracterize the person's answer? Because it's all on the tape.
And we also record all of our evaluations too at Mississippi State Hospital. I had a question though, because we have been transitioning to using video conferencing for outpatient evaluations of inmates who are currently incarcerated in different jails. And my question is, we discussed the limits of using video conferencing technology in our reports, such as the technological limitations, the behavioral observation limitations, and the limits of confidentiality, especially if overheard, or having it not be in our kind of secure conference room. I was wondering if there are any other kind of limitations that you think would be important to discuss in our reports.
I'm going to give you the same answer. It depends. So part of that's just your own judgment with each evaluation is if the person kept turning their back to me and it looked sketchy and I couldn't tell what they were doing, and I how come you keep turning your back to me? What are you talking about? I'm not, or never mind, or I don't want to talk about it. Then I might document that there's something going on that I don't think I can assess adequately on television. Most of the time, most of the people I know who do evaluations think that most of them go fine on video, and some don't. Well, that's sort of how life works, as far as I know. One size doesn't usually fit all for very many things. So there might be a case where you have to take another crack at them, or you need, maybe for a case, you need a ton more collateral information. So it's going to be case by case, and you just have to be honest about, I mean, that's what the ethical rules require us to do, is to be honest about what we perceive as the limitations of whatever method we're doing of the evaluation. I mean, if you think about it, many evaluations, the people I feel the most sorry for are people who have to do evaluations with no collateral information at all. Like a lot of disability evaluations, people don't get any collateral information. I thought, how would I do that? That would boggle my mind. People figure out ways to do it. They do more effort testing and so forth. So I don't have a really good answer for you, except to say that you just have to cross-examine yourself and say, what do I think I didn't learn from this that I would have learned or could have learned if I had been able to do it the old-fashioned way?
And I have one final question, if I may,
Sure.
regarding video conferencing. I have my first Zoom competency hearing coming up next week. And I just wondered if there was anything important to consider or keep in mind, aside from providing, the usual expert testimony that I would in person, with you doing a video conferencing competency hearing.
Not really. I think in some ways it's going to be easier. They can't get in your face. They can't, it's harder for them to try to bombard you with rapid fire questioning to throw you off. It's going to be a relatively polite circumstance. They're probably not that much more comfortable with it than you are. So you might sort of have to muddle through it together. And the judges are going to be, I think, even more than usual, try to run the show to make sure people don't talk over each other and stuff like that. Anybody else wants to jump in on that, please feel free.
Hi, I'm Amanda Gigliano. I also work at Mississippi State Hospital with Stephanie Howard. And I have not done a video conference testimony, but I have done testimony over the telephone. And I found what you said, Joel, to be accurate, that it was much more polite, less contentious. I didn't feel that cross-examination was what it typically is. But I also found it difficult for me, and I think Zoom would be better because at least then you can see people. When I was doing it on the telephone, I really didn't like it because you couldn't see anyone.
Yeah, I actually I was scared of Zoom, but I just did a 8-hour training for the American Academy of Forensic Psychology on Zoom, and it was amazingly comfortable. It didn't take me very long, and this is comfortable for me. I'm not having a problem with this at all.
And in regards to the third person observation or having an observer, I have worked mostly at Mississippi State Hospital, but I've also worked at Central Regional Hospital in Butner, North Carolina, doing forensic evaluations. And I do evaluations privately. So I've been in situations where it is standard for us to have third-party observers in the room, whether that's other disciplines, like maybe the individual's case manager if it's an inpatient competence evaluation, or attorneys, students, whether that's psychiatry residents or psychology trainees, and MHTs. And then I've also been in the situations where it's just me and the defendant. And in my experience, I have not found that having someone in the room has been significantly detrimental in most cases. There are some cases where an individual may have some paranoia or delusions, particularly about another person. And in those cases, I arrange to have less people in the room, or for it to just be maybe me with the defendant and the mental health tech sitting outside of a room where it's plexiglass and they can observe. So if they need to intervene, they can. But I also like having an observers, because when they're in court, at least for competency evaluations, I like having observers, because when they're in a courtroom, it's not going to be just them and their attorney. And so I want to see how they can function and how they can think and how anxious they get when they're asked questions or asked to do things in front of maybe a group of people.
What you're describing is just really good common sense and problem solving. So if somebody looks like they're, they hate the person that's the third party observer, well, they might hate the person. So maybe it should be somebody else. So it's just, what you're describing is exactly right. You just got to look at the situation and make a judgment call. But I mean, I learned testing, there was always somebody else watching. Thank God, because I wasn't very good at it at first. So it was probably a good idea.
I have a statement, if I may, and then a question. I'm Vicki Roberts from Atlanta, and I work for Emory University here. Hi, Dennis. Hi, Joel.
Hi, Vicki.
Been a while. I just was wanting to say that we've been doing evaluations with Zoom, and the courts helped us set them up because they're having like first appearance hearings and bond hearings. So they helped us access defendants in the jail so that we could do our evaluations. And just commenting on the third party thing of when someone is around, we have found so far that almost every defendant did okay with it, except for 2 people, and both of them were child molestation charges, and they would not participate in the interview. And, you know, that was fine. We knew that there was a possibility of that. But for the most part, all the defendants have been pretty willing, and we've got a pretty good setup for them. We're also running a jail-based competency restoration program in the big Fulton County Jail in Atlanta, and we're doing it all remotely. It's just been kind of wild, but we use the phones on the walls. We call into them. We use their visitation video conference setup, and then we also have a laptop that we put in the area, in the zone, and hook it up to the TV, and we run interactive groups on Zoom. So it's been kind of a wild ride, but very gratifying. And the only other thing I was going to say is that I am just amazed at how thankful the courts, the judges, the defense attorneys, everybody seems to be just really glad that we're doing something, and kind of doing our regular caseloads and things like that. And it's built a lot of goodwill, I think, in the jail as well. So we've had a few little ethical dilemmas that came up, but for the most part, things are going well. So I just wanted to say something about that. Thank you for the time.
By the way, a quick word about that Emory program. I saw Peter Ash present the data from that. It's pretty impressive data set that he presents. So
it's pretty wonderful.
Yeah, I've been very cautious about jail-based programs, but there are a few of them that are really good. The one in Colorado, the RISE program, yours seems to be having really good success. So when
is that
people,
the Arapahoe program, or?
Yeah, that's, well, it's in, isn't it? I think it's in 2 places now, if I remember correctly.
Oh yeah. Boulder.
It is.
But they're also not cheap programs. If you do them, you have to do them right. And that means they can't be done on the cheap. So
Right.
Who else?
There's
a
actually
training question.
Yes.
So I'm a director of clinical training, and I have students all over the country who are at prisons and jails and state hospitals, and I've been really impressed with the response to helping interns meet their clinical needs. But I've noticed that, at least in our area, our state hospital and both of our prisons won't let practicum students come in. And so I was curious if you know of any resources, or if anybody outside of Joel that's in the room has some resources or a plan in place of how they're letting practicum students come in and train. Because it's led to a substantial loss in hours for people who are applying for internship.
You're in Eastern Washington or?
Western Washington, the epicenter.
When you say they won't, are you talking about who is it that won't let practicum students in?
Well, it sounds like it's more of an organizational issue, which probably has legal implications, but I'm curious if other organizations have gotten around that, or if there's something that could help psychologists advocate for their students to administration to let them back in.
I mean, it's a lot of places don't have the problems. I think I would try to find out where it was coming from first, and try to meet with whoever it was that was saying that. So if it's the prisons, you might want to try talking to Bruce Gage or Tony Tony Rome, and see if they even know about this and what their opinion is of it. And if they don't want them, why? What their thinking is. They may not understand how much supervision they're going to get or what your role is. Once they meet you, it's a different question. If they haven't met you, it's just a anonymous request. I used to tell people, it's so easy to say no to a memo. It's so hard to say no to a person that's asking you for help. So that's one thing I would do. If it's at the hospital, I don't forget who the CEO is now, but I would do the same thing and say, who says no? And what's their reason for saying no? And what can I do to turn that no into a yes? I mean, off the top, I haven't really run into it very much. I did practica, or they called them externships, all through my graduate school. It was the only part of my graduate school that I liked. and I learned a ton there, and they seemed to value my work, and they were nice to me. They had a party for me when my year was up. So I would just try to do a better job of figuring out where the no was coming from before I try to turn it into a yes. Anybody else jump in on that?
There is a question in the text box, but
Oh,
kind of wrapped up.
it's in like a 1-point font. I have to.
I can read it if you want.
Please.
Yeah. So, but it doesn't have to do with the practicum. So if anybody does have comments on that particular issue, we could maybe wrap up that question before moving on to this one.
This is Amanda again at Mississippi State Hospital. I don't know, about other places, but we have practicum students here and interns. Sorry, my dogs decide to go nuts whenever I unmute myself. But we have practicum students, interns, and postdocs here, and we have not stopped them from coming to the hospital to provide services. What we have done is limited the amount of time they're at the hospital and staggered even all of our staff also. So people work 2 days from home and 3 days here. But for the practicum students, they're still here the 2 days per week. But we've been providing things like supervision via video conferencing. Lulu, stop. Supervision via video conferencing. And
Don't worry about it. She's fine.
and everything we can do, didactics, all of those things are being done via video conferencing. And then whenever they are providing services to patients, they're having to wear masks on patient buildings anytime they enter a patient building. We're doing things like wiping down with disinfectant wipes surfaces both before and after sessions, like the chairs and the tables, all of that. It all gets wiped down before and after. They are not able to provide services on buildings that we have quarantines. So if there are some active cases or there's a question about active cases, some of those areas are being quarantined and they can't provide services in those areas, but all the areas that are not quarantined, they can still provide services on. And we've been encouraging them to get creative and take groups outside so each person can have 6 feet of distance. We have requirements that you can't have more than 10 people in a group, and that includes the facilitators, and there has to be 6 feet between each person in the group. And if they cannot do that, then they may have to limit the group even further or focus on individual services rather than group services. So we've just made some changes, but they're still able to get direct hours.
Jenny, was your question mainly about COVID, or was it before that?
Oh, it's just about COVID. No,
Okay.
I'm super grateful to the state hospitals and the prisons for how much hours and supervision they provide to our students. But yeah, as soon as COVID hit, some were a little bit more hesitant to let go of students, but now almost all of them have students kind of on pause.
Okay.
So
You want to read that question?
Yep. So this question is about psychologists and counselors in prison settings. And the question is, should language be added to mental health treatment consent forms so that inmates or offenders are aware of the risk of possible exposure by meeting with treatment providers?
Well, that's a great question, and I don't have a clue. If I was still running a system and were asked that question, I would immediately go talk to counsel and ask them. I don't know. It's a legal question, really. I don't think ethically you're not adding risk. I mean, they see a whole bunch of people every day who come in and out. Staff go home and then they come in. But they may tell you to do it, or they may tell you don't do it because I just don't know. Are there any lawyers on the call? Yeah, sorry, who's that, Wesley? I would say ask a lawyer. I don't know the answer to that one. If I did it, I would be worried about overdoing it and scaring the person more than is reasonable. But again, I would talk to an attorney about that question. Sorry, you stumped the band on that one.
So we have just a few minutes left, and I wanted to, I had a question that I wanted to end on, unless people have something burning they want to say. And if you have questions afterwards, feel free to email me. And I'm kind of volunteering you here, Jill, but
yeah, that's fine. Everybody has my email address, so it's joelthed@aol.com. I think I'm the last AOL person in the whole world.
So if you have other questions after we're done here, please feel free to email Joel or email me, and I'll pass your question on. But like I said, I had one I wanted to end on. Joel, do you see any silver linings in this crisis as it relates to the treatment or assessment of justice-involved persons, or those of us working directly with them?
I have been called in many times a pathological optimist. So I have a natural tendency to see silver linings, even when they don't exist, I think. But I mean, this sucks. Yeah, we'll come out of this and we'll make changes, and some of them will be positive, but we sure didn't need this to improve ourselves. I mean, I feel so bad for the people. I mean, I'm lucky. I have a nice house and I can afford to quarantine myself. Not everybody has that luxury. People in jail don't have that luxury. People in hospitals don't have that luxury. So I feel it's hard for me to say a silver lining, but I will say that every time we go through a crisis, we learn things that make us better for the future. And one of them is, this isn't the last time we're going to have some kind of unprecedented health crisis. And I do a lot of work designing secure psychiatric hospitals with architects. And for years, I've been saying, how come we don't have more isolation rooms? And they always go, well, they're expensive. And I go, yeah, but what if there's an air, I mean, this isn't airborne. This actually could have been worse. If this was airborne, it could have been even worse. So we're going to learn things about hospital construction. I predict that there's going to be new filtration systems that will take the place of negative ventilation isolation rooms. and the price of them will go down as they start to get manufactured, more of them. That may be something that's positive that comes out of this. I think many people, myself included, took safety and health for granted more than we should have. That may be something that positive that comes out of this. But at the end of the day, it sucks. And for those of you who work in institutions, besides your own fears and sadness and losses, it's really hard to work with people who are up against it and don't have any way to feel safe. So I would say that the fact that you're willing to do your job under these difficult circumstances, good on you. That you're going to get appreciated for this. I think in ways that you're going to find gratifying when the smoke clears. And let's just all pray that happens sooner rather than later.
Thank you for that.
Thanks everybody for joining us and for your attention. I appreciate it. And if you ever want to do this again, just let me know.
Thank you so much, Joel, and thank you to all of you who tuned in. This is more people than I was expecting would show up, and I really appreciate you all taking the time, and I hope that you were able to get something out of this and have some new insights, and hope that everybody stays safe out there and well. So, and please let the criminal justice section know if there's anything else that we can provide for you or assist you with, and we'd be happy to try to get information out to you as best as we can. So thank
Ashley, I just want to, before I leave, I just want to say you are the very best section president in the history of Division 18.
Well, we are recording this, Joel, so there's going to be evidence that you said that.
I'll say it again. You're working so hard to do this job well, and I really appreciate it. Thanks for inviting me.
Thank you, Joel. Bye, everybody. Thank you so much.